As you can recall, the sacrum has an apex and a base. And there are four surfaces that we'll be discussing. First of all, the dorsal surface, the pelvic surface, and the two lateral surfaces. You can appreciate over here that there are 5 sacral vertebrae fused together. In any case, if we could possibly separate them, they would appear like this, resembling any normal vertebrae of this region, having a body, transverse processes, and other parts not appreciably visible in this diagram. To study the base of the sacrum, it would be beneficial for you to look at the superior aspect of the sacrum. So let's zoom in. If you observe closely, it is shaped like a butterfly. Most centrally placed is a rounded body, slightly indented. The body is lumbar in type and articulates with the lumbar vertebrae L5 at the lumbosacral joint. The projecting anterior margin on the anterior surface is known as the sacral promontory. There is a triangular vertebral canal as shown here, which is leading into the sacral canal. The pedicles are short and directed in the backward direction. The lamina joins at the back and forms the spine, which is forming the first spinous tubercle. The pedicles are short and directed in the backward direction. The lamina joins at the back and forms the spine, which is forming the first spinous tubercle. These are the superior articular processes having facets on them that are directed backward and medially. These are the superior articular processes having facets on them that are directed backwards and medially. These wings of the butterfly are basically the transverse processes that are highly modified. Each process is massive and fused with the corresponding costal element. The apex of the sacrum can be appreciated here, which is formed by the inferior surface of the 5th sacral vertebrae, and it bears an oval facet for the articulation with the coccyx. Now moving on with the discussion of the pelvic surface. It is concave and directed forwards. Starting off medially, we have these 4 transverse ridges which indicate the fusion of the bodies of the 5 sacral vertebrae. These ridges on either side end at the 4 sacral foramina, which communicate with the sacral canal. Most laterally, we have the lateral masses, which are formed by the union of the costal elements. Now, if you look at the dorsal surface, it is rough and convex. I'll start explaining it from the midline. If you notice, this median elevation is known as the median crest, which is also known as the spinous crest, and it bears tubercles known as spinous tubercles, almost 4 in number. Below the 4th tubercle, there is a gap known as sacral hiatus, which is formed by the failure of the fusion of the lamina of 5th sacral vertebrae. As we move laterally, there are some of the features that can be appreciated on the lateral view only, such as these lateral lamina. Lateral to the lamina and in line with the superior articular process of the 1st sacral vertebrae are 4 articular tubercles representing the 4 articular processes fused together of the adjacent vertebrae. The inferior articular process of the 5th sacral vertebrae are free and form the sacral cornua, which project downwards at the sides of the sacral hiatus. The dorsal surface is having lateral sacral crest having transverse tubercles that are representing the fused transverse processes. Here, the vertebral bones are fused together. We can observe these projections that are the transverse tubercles. Now discussing the lateral surface specifically. It bears an L-shaped articular surface area anteriorly and dorsally is present a dorsal pitted area. Now remember what articulates with this. It articulates with the hip bone at the sacroiliac joint. The posterior roughened and pitted area is formed by the transverse processes. This tiny edge here is known as the inferior lateral angle of the sacrum. Talking about the sacral canal, it is a very important structure as it lodges the spinal meninges. You have to remember that the filum terminale and the subdural and subarachnoid spaces end at the level of the second sacral vertebrae. Therefore, the lower sacral nerves and filum terminale pierce the dura and arachnoid, that is, the second sacral segment.